Dr. Brebaut here. Let's do our medical term for the day. And today I want to do a heart condition called aortic stenosis. First, we need to do a little anatomy lesson. There are four valves in the heart, and these valves are what controls the blood flow through your heart into the rest of your body. The four valves are the mitral valve, the tricuspid valve, the pulmonic valve, and the aortic valve. Aortic stenosis or aortic valve stenosis is when the aortic valve, which separates the left ventricle of your heart from your aorta to pump blood through the rest of your body, when that valve becomes tight or squeezed down for some reason, that is called stenosis. It makes it very difficult for the ventricle to pump blood out into the aorta because it has to go through a constricted space. Normally, that's a three valve or a three leaflet valve that is freely opening. With stenosis, it can no longer do that. This results in a lot of problems: strain on your heart, poor oxygen supply to the rest of your body. You can develop congestive heart failure. One of the main warning signs that you have impending death or impending problem within a short amount of time is passing out. If you have syncope, which is fainting, and have severe aortic stenosis, you have to have intervention. This is probably most likely due to the fact that if you're doing a activity that requires an increased amount of oxygenation, the heart can't provide it because it's trying to pump through a fixed area, and it is limited in how much blood it can get out. So your activity overworks the amount of blood and oxygen it can receive, so you don't get blood to your brain, so you hit the ground. This is a very ominous sign. Other things that can indicate very poor outcome: if you're having chest pain, related to your aortic stenosis, if you go into heart failure related to your aortic stenosis. These are all very problematic things. Treatment: sometimes you can do some medicines to buy yourself time. Sometimes they can go in and do what's called a valvuloplasty, where they go in and open up and break up the aortic valve to let it work more freely. But most of the time, you end up getting that valve replaced. This is more common in men over the age of 65 that smoke, that have high cholesterol problems, that have hypertension, but it can occur basically to anybody. So there you have our medical term of the day, a quick little treatise on aortic valve stenosis. If you have any questions, throw them at me. Repost this, share this with people. I would really appreciate it.